I made the elbow joint for this assignment, and here's the special feature for it. I used the hookless strips, so the bony landmark muscle can be removed and attached multiple times. Here is the capitulum and trochlea, and the medial epicondyle, olecranon, fossa, and the lateral epicondyle. And moving on to the ulna. Here we have olecranon tuberosity and ulnar style process in distal part, and ulnar tuberosity in proximal anterior aspect. And lastly, radius. We have radial head, radial neck, and in the proximal part, and radial tuberosity in the proximal anterior aspect, and radial stylo process. Because I use the hookless strips, I am able to stick them together. Now we can mimic the movement, the ulnar humeral and the radial humeral joint, which is flexion and extension at those two joints. And moving on to ligaments, we have three main ligaments in elbow joints: radial collateral ligament in lateral side, and then we have the ulnar collateral ligament in the medial side. And an annular ligament in an anterior aspect. And here comes the muscle. I only make medial and lateral head for tricep brachii, as the long head starts from scapula. Lateral head originate from posteriorly to the radial groove, and medial head originate inferiorly to it, so it performs extension at elbow joint. And biceps brachii originate from scapula as well, so there isn't a specific arranging here, and it attached to the radial tuberosity. Biceps performs flexion at elbow joint. Supinator's arranging is the lateral epicondyle, and it inserts into the lateral surface of proximal 1/3 of radius, and it supinates the forearm. Brachialis originates from distal anterior humerus and inserts to ulnar tuberosity, and it flexes the ulnar humeral joint. And for the pronator teres, which pronate the forearm at the superior radial ulnar joint, originate from medial epicondyle and inserts into the medial lateral aspect of the radius. For nerve and blood supply, musculocutaneous nerve is responsible for biceps and brachialis, while median nerve innervates pronator teres. Radial nerve is the innervation for triceps and supinator. And lastly, we have brachial artery. The main idea for this assignment is that it can attach and remove multiple times for learning purposes, so a student can be better at the landmarking the bony landmarks, and they can visualize the muscle better if they can attach to them by themselves.